numbness on one side of the face or body, sudden and severe headache, weakness or paralysis, trouble seeing, difficulty in speaking. These are the possible signs of a stroke. Go to a hospital or call an ambulance right away. Hi, thank you for tuning in. I'm Hafni Shahzanani and this is Medic TV. Cerebrovascular accident CVA or cerebrovascular insult CVI are the scientific names of the medical crisis. What is a stroke? A stroke is also called a brain attack. It occurs when something blocks blood supply to part of the brain. It could also happen when the blood vessel in the brain bursts. How does it happen? A blockage in the blood flow to the brain prevents it from getting oxygen and nutrients from the blood. Without oxygen and nutrients, brain cells begin to be damaged and die within minutes.
How many types of strokes are there?
Ischemic stroke, hemorrhagic stroke, transient ischemic attack or mini stroke, brainstem stroke, and cryptogenic stroke or stroke of unknown cause.
What are the causes of a stroke?
There are diabetes, high blood pressure or hypertension, heart and blood vessel diseases, high cholesterol levels, and smoking. Let us cross over to our field correspondent, Amalia Atira at Geriatric Rehabilitation Ward of Hospital Kuala Nerang. She is going to speak with a specialist about the treatments available for stroke patients. Over to you, Amalia.
Thank you, Hafni Shahzanani in the studio. Hi, I'm Amalia Atira and this is Medic TV. If you feel like you are suffering from stroke, it is best to get to the hospital as soon as you can. The emergency team will determine the type of stroke you are having through a CT scan or MRI at the hospital. First and foremost, a combination of medicines can be prescribed immediately to stroke patients. Secondly, thrombectomy procedure will also be done to remove blood clots and restore blood flow to the brain. Next, prescription of anticoagulants like edoxaban, warfarin, or heparin will be administered to reduce the risk of developing blood clots in the future. I am fortunate to have Dr. Tiam Chiani today to speak about geriatric rehabilitation for stroke patients. So doctor, what is a geriatric rehabilitation?
Geriatric rehabilitation refers to a multidisciplinary team efforts and management in restoring some or all of the functional or mental capability that have been lost either due to the diseases, injury, or illnesses.
Who are the people involved in geriatric rehabilitation?
We need a multidisciplinary team that consists of doctors, nurses, pharmacists, physiotherapists, occupational therapists. Sometimes we also need extra people, for example, speech and language therapists, dietitians, or social workers.
Why is geriatric rehabilitation important for stroke patients?
Rehabilitation helps the patient to regain the lost abilities of functions to their best extent. It can be as simple as the ability to walk, the ability to talk or communicate, and then to the ability to maintain their self-care and also carry out their daily activities.
Thank you, Dr. Tiam Chiani, for spending time with Medic TV today. Have you ever wondered how stroke patients undergo their follow-up treatment? Let us watch a video of geriatric rehabilitation ward and physiotherapy session for stroke patients in Hospital Kuala Nerang. Do you know that this is the first hospital to have a geriatric and rehabilitation collaboration in Malaysia? Let's find out together. Remember, stroke is not the end of your life, but rather the beginning of a new start. Everyone is involved in a patient's road to recovery. We must play a vital role and join hands in hands to provide physical, emotional, and monetary support for stroke patients. Credit to Geriatric Rehabilitation Ward of Hospital Kuala Nerang for their remarkable effort in providing wholesome care for stroke patients and support for their family members. That's all the time I have for now. I'm Amalia Atira for Medic TV.
Thank you, Amalia Atira. Let's focus on early treatment for good prognosis. The first 60 minutes after the onset of stroke symptoms are known as the golden hour. If treatment can be initiated within this brief window, the patient's outcome is likely to be better. Recognizing the early warning signs of a stroke can minimize the risk of permanent damage and death. Well, that's all the time we have. To stroke patients, please remember, it does not matter how slow you go, as long as you do not stop. In the words of Kate Elliott, a stroke survivor, start thinking of wellness, not illness. Till we meet again, take care.